Disclosures for this and all episodes in this series can be found on the podcast series destination page, located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast was developed through a strategic collaboration with the National Alliance on Mental Illness, supported by an independent educational grant from Takeda.
Hello, everyone. My name is Dr. Rakesh Jain, and I am a psychiatrist. I am a clinical professor of psychiatry at the Texas Tech University School of Medicine in Permian Basin, and I am also in private practice. Welcome, everyone, to this podcast episode, Making a Treatment Plan for Depression with Your Healthcare Team. This is part of the 6-episode podcast series, What to Know About Depression. Today, I am very glad to be speaking with Darren. Darren, you and I have spoken before, but for our listeners, can you tell us a little bit about yourself and your experiences with depression, perhaps starting with when you were first diagnosed?
Sure. And thanks, Dr. Jan, for this opportunity. And thanks for having me here today. I was officially diagnosed with depression probably 15 years, 16 years ago, maybe just a little bit longer than that. What triggered me getting into where I could at least get a diagnosis of depression was I had a close friend who committed suicide, and I just didn't have any skills to pull myself back up again. So I slipped into some really bad old behavior patterns. I remember thinking to myself that I just can't do this. Something's different this time. I just can't fix this and I need some help. So I started seeing a therapist and we started getting into some of my childhood stuff and all of the acting out and misbehaving and risky behavior that I was exploring and exhibiting back then. And then it was like, I'd gone to the doctor and had a full medical check. They'd done all the things that they needed to do and got my medical stuff in line. So then we just kind of dove into why I wanted to stay in bed with the covers over my head every day or drink until I fell asleep so that I wouldn't have to confront the day.
Thanks so much for sharing that, Darren. That's a very personal story, and we appreciate you being so open and for kicking off this important topic. And so today, dear listeners, we are specifically talking about major depressive disorder, or MDD, or what we commonly just refer to as depression. And this is one of the most common mental health conditions in the United States. And in fact, up to 25% of adults can have depression at some point in their lifetime. But it can also happen in teens and even in children. And while depression can indeed run in families, it can often affect people who have no family history at all. And sometimes it can happen just once, but for others, it can be a recurrent disorder with several episodes in their lifetime. And it sounds like this may have been the case for you, Darren. So, then, just to remind our listeners, this condition that we're talking about, depression, is a mood disorder that causes feelings of sadness that won't go away and a loss of interest in things one normally enjoys. And when people feel depressed most of the time, for most days, for nearly, 2 weeks or more, that's what we call major depression. And it can affect things like emotional health, physical health, even cognitive health. And people can have lots of symptoms. In a moment or two, we'll hear from Darren what her journey was like. But the majority of my patients tend to have symptoms that are mood, sometimes anxiety, sometimes irritability, tiredness, sleep problems. Oh my goodness, so many difficulties, and sometimes trouble with memory or difficulty making decisions. And things can kick it off, like as we heard from Darren, the loss of a close, loved family member or a friend. So it's so important, like Darren just talked about, that one has to find a wonderful healthcare provider so that we can actually address it. That's often the first step. So, Darren, could you talk a bit more about how you ended up partnering with your healthcare team member in the creation of your own individualized treatment plan?
That's a great question. So I have quite a few different components of my treatment plan, and I've had to work really closely with my therapist because with my depression, I couldn't identify some of the things that were going on that were um, relative to my depressive disorders. I tried several different medications. Some did not work at all. Some made me actually feel worse than what I did before. I had some of those side effects, having some weight gain and some other struggles. And through the course of everything, I kind of began to realize and get consistent about a medication regimen. One of the meds that I took really took my highs and my lows and kind of bumped them up a little bit and bumped them off a little bit so that I could get up and function and get to work every day so I could hold a job and feeling like I didn't need to hide somewhere. There was a lot of talk therapy in my treatment plan. And I should mention, too, in addition to all of this, I was diagnosed with breast cancer last year. So it's important that if we have a chronic health condition, we also talk about our mental health.
Yes, I'm so sorry to hear that, Darren. It's not as if you didn't have enough on your plate. Breast cancer is a momentous occasion in anyone's life. So I'm assuming you shared this with your healthcare team, right?
Oh, of course. But it took me a little bit to figure out that I needed to. I'm of strong Irish, German, descent, and so we always kinda have this, "I got this, I can do this, I can do anything," and of course, my education, I'm a therapist myself, so, I've got this, I'm gonna be okay, and then I fell into this really deep depression that I didn't even recognize until one day, laying on the radiation table to get treatment when I started to cry and I just kind of lost it, and that was the day I said, "My oncology team needs to know about this. I can't do this alone. I can't manage my depression with this additional big thing." So I was able to sit with my oncologist and my surgeon and have a really great discussion about my major depressive disorder, my anxiety, and other things that were going on as well. And she was able to talk with my prescribing doctor for my psych meds and adjust my medications just a little bit to help me out. I really kind of believe that if I hadn't told her about my condition and the treatment, that my cancer treatment might not have gone as well as it did. Depression doesn't just go away. There are just layers and layers and layers to it that you peel it off like an onion skin. And breast cancer certainly was a big layer of onion skin to pull off with my depression.
I certainly appreciate your sense of humor and the beautiful analogy that you've offered me and the listeners. And I got to give you a lot of credit, Darren, for fostering that communication between so many different members of your healthcare team. You said it so well. You and your treatment team together are a powerful entity. And because I know that a lot of people don't necessarily do what you did, they often do silo their conditions and say, well, I see this doctor for this condition, say breast cancer. Why would I tell them about my mental health challenges? Or sometimes the other way around. So I think that it is really important and really great that you recognize that there can be an overlap. And through your example, I think our listeners will learn that when you're faced with depression, creating a wonderful treatment team is really important so that they can communicate with each other and offer the very best help for us when we are patients. And then that you were able to feel comfortable enough to have those conversations and that you made it happen is something to commend, Darren.
When I think about it today, I don't know that I would have 5 or 10 years ago had a conversation with the doctor about it. I probably wouldn't have said anything at all. I would have just kind of knuckled through and dealt with the depression and probably go back to some old behavior patterns. But I realized that it's a process. You can do the medications, you can do great therapy, you can get great education and know all kinds of things about mental health. But in this amazing world that I currently live in, my depression is still there and I still have to tend to it.
Yes, tend to it. to take care of it, to manage it, and to thrive despite it. I love what you said. And it sounds like your treatment team really does help you go forward. So, yes, everything you said, it's exactly right. And I'm wondering, as part of your treatment plan, did you talk about your lifestyle or any lifestyle changes with your clinician as well? Because I have heard from many patients, and the research states so as well, that those of us who live with depression find that lifestyle changes can be sometimes very helpful. What are your thoughts?
Yeah, boy, that's a big area of discussion. We talked a lot about my risky behaviors and what I was doing and the alcohol abuse and trying to rein some of that back in. We had a lot of conversations about me getting more active, not jumping into the gym and doing this, I've got to exercise kind of thing. But everything just really kind of came to a head at the same time and I started to take some really big steps towards getting healthier. I know you can't see me, but I've lost about 250 pounds just by getting active, eating better, making some better choices about what I'm doing and what I'm putting in my body. And I feel so much better.
Oh my God, I am so amazed. I was impressed with you, Darren, at the beginning of the conversation, but even more so. So tell us a little bit more, if you will, please.
Well, I know with my depression, I just kind of fell into the black hole and I wasn't really thinking about what I was eating, what I was drinking. I had this kind of mentality that the only time I got up was to eat. So I was kind of living just to eat. So I've kind of gotten my head around that I eat to live, I eat for fuel. So I've done a lot of work around my coping mechanisms, my comfort stuff, food, particularly. I am a comfort food eater. So during my childhood where I was depressed and being traumatized, I didn't really know what to do with all of the feelings and things that I had, so I developed some skills. One of them was being able to cook and to eat massive quantities of food. So my therapist and I began to peel back each one of these things and look at it and say, is this a good skill, a good coping mechanism for me? Or is it not so good? I'm not really saying that they're bad, but is this really a good skill for me? And what do I want to do with that? So we did some skills assessment, which was really very interesting for me. But mostly, I learned that there were skills that I used then that I can use now, such as I learned to play the guitar. And that was a coping mechanism for me and it was a good thing, and it's still a good thing, so I need to remember to, pick up that guitar and play it because it really helps even today with some things. So and then there were other things that weren't so good for me, so we just kinda looked at it and said, "Do I wanna keep this or do I not?" And as we peeled back those layers and got to some core pieces of who I am, I was able to make some shifts in my behavior, shifts in my eating, shifts in my self-medicating, my alcohol use. So, they had me working on a schedule too. I got out of bed at a set specific time, taking a shower every morning, and at least accomplishing something for myself every day. And then then it was just accomplishing something for myself, and then it moved to accomplishing things for other people. It's really kinda like being reprogrammed to think differently about who I am in my life with depression.
Gosh, loved, absolutely loved hearing your story of recovery. And your point about reprogramming things differently with the help of your therapist, examining what you were doing that was helpful, what wasn't, and then, as you said, reprogramming it. That is just so wonderful. Everything you said is incredibly valuable to me, and I suspect to our listeners too. So it sounds like finding a clinician and or a healthcare team, creating one that you're comfortable with, trust them, is really important when you're treating your depression. That appears to be the key. And because depression is treatable, talking with your healthcare provider openly, as comfortably as clearly Darren did, is incredibly important. Now, half of the psychiatric or mental health visits now are with nurse practitioners or physician assistants. So, finding that provider who's just right for you is very important. But perhaps the most important thing is no matter who your healthcare provider is, open communication. That is without a doubt something that Darren and I both believe in and would recommend it. And of course, the next, it sounds like that the healthcare team member, and you really need to embrace a model that we often call the biopsychosocial model, because that particular model really addresses every need of the person. The biological challenges a person might have, sleep wake cycle, for example, or a medication for the depression. And then psychological, examining thoughts and emotions and behaviors. And of course, social. How is your environment? What are you doing with it that works well for you? And this biopsychosocial model has been of great benefit to us, along with wellness interventions and lifestyle interventions, as we heard from Darren, her picking up the skill set of playing the guitar, changing her cooking habits and eating habits to lose a profound amount of weight. That is just wonderful. Wonderful, really. It is such a pleasure speaking with you today, Darren, and I can see how you can make an impact on the lives of people by articulating your story, because the process can be frightening, but you are shining light on this process and you're reducing the concerns people have. If you can, please add a couple more thoughts before we close out.
Sure. It can be very frightening. I think the hardest part for me was realizing that I wasn't really walking in plan A for my life and that somehow I'd sold myself short because of my depression. And in selling myself short, then it was okay to do those risky behaviors and stay in bed for days on end because really, who cared? I think the scariest part for me was getting to that point, that lowest point where I said, okay, who are you and what do you really want to do? And trying to figure that out. So, mostly what I want to leave people with is that there is hope and that there are people there to help and to work with. So, create a team so that you can find the treatment plan that works for you, whether it's social workers, case managers, psychiatrists, medical doctors, ARNPs, those nurse practitioners I think are wonderful. Find a good therapist. And if you don't find the right fit, go to another therapist. Make your team work for you because, after all, they do work for you. So just create that team that you can be comfortable with is the base of importance.
Golden words of wisdom, Darren. You're giving us such a great roadmap for success. And because it's hard to travel without a map, and that's what I think you offered people, along with profound amounts of the most important ingredient of everything we do in life, and that is hope. Thank you so much for being a part of this.
I'm really honored to be a part of this. And I think the more we tell our stories, the more people realize that we are more similar than we are different. And we all have our own struggles of some kind or another. I don't think since the creation of time that there's been a perfect family or a perfect life. I think we all have some measure of dysfunction and probably a little bit of a measure of a mental health condition. We're just not diagnosed and we've never talked about it. So I think the more we tell our stories, the better it's going to be for all of us.
Well put, Darren. That's exceedingly well put. And you have highlighted the great importance of not just taking personal responsibility for the management of depression, but leveraging the benefits one derives from creating a wonderful healthcare team around us. So, Darren, you have my greatest gratitude for your words of wisdom. And thank you to all of our listeners as well. Goodbye for now.